When we think about the future of global health, we often imagine solutions that are bold, transformative, and at times still out of reach. But what if one of those solutions already exists, and it works not by adding something new, but by selectively taking something away? That idea of targeted degradation captured my attention when I came across PROTACs. These are molecules that don't just block bad proteins like many drugs today, they help completely eliminate them. It's a fundamentally different way of approaching disease treatment, and it could change how we fight cancer, neurodegeneration, and more. But before I dive into what PROTACs are and how they could transform global health, let me introduce myself. Hi, my name is Vivaan Sharma, and I'm a rising senior at the Academies of Loudoun and Rockridge High School. I'm based in Ashburn, Virginia, and a little bit about me is I'm the Vice President of my National Honor Society chapter. I'm the Vice President of BioSpark ED, a STEM equity initiative teaching thousands globally about computational biology. I shadow physicians at a local hospital. I conduct research on AI optimization in healthcare delivery as well as biomedical research, which consists of protein modeling and medical device testing. I've competed in HOSA and Science Olympiad, where I've qualified, and I've played guitar for around 6 years. Additionally, I'm passionate about scientific writing and communication. Let's talk about the problem with current treatment today. Most current drugs don't eliminate disease-causing proteins. They just block them. These are called inhibitors, and while they can slow down the disease, they don't remove the root cause. Take cancer as an example. Many cancers are driven by overactive proteins that tell cells to divide uncontrollably. Drugs may inhibit those proteins, but often that inhibition is temporary. Once the drug wears off, the protein still remains. This is part of why drug resistance is such a big problem. Tumors can adapt, mutate, and become resistant to inhibitors, meaning treatments stop working over time. In fact, nearly 75% of disease-causing proteins are considered undruggable by traditional pharmaceuticals, meaning they have no obvious binding sites where drugs can latch on. In Alzheimer's, for example, over 50 million people worldwide are currently living with the disease or related dementia, but currently treatments only manage symptoms. They don't remove the toxic proteins that cause the damage itself. So, we need a better solution, and that's where PROTACs come in. PROTACs, short for proteolysis targeting chimeras, are small engineered molecules that don't just block proteins like traditional drugs do. Instead, they destroy them. Here's how it works. Every cell has a quality control system called the ubiquitin proteasome system. Think of it like a built-in garbage disposal. PROTACs hijack this system to get rid of harmful proteins. In the image on the screen, the yellow shape is the protein of interest, or POI, the bad protein we want to eliminate. PROTACs act like matchmakers. They bring the POI into contact with an enzyme complex made of E2 and E3. The E3 ligase tags the protein with little markers called ubiquitin, those purple ovals you see, telling the cell it's time to get rid of these. The protein then gets broken down in the proteasome, basically a protein shredder. The coolest part? PROTACs are catalytic. That means one PROTAC can trigger the destruction of multiple proteins, and they don't get used up in the process. This makes them incredibly efficient and opens up doors for treating diseases that current drugs can't touch, like cancer, neurodegeneration, and even certain genetic disorders. But let's talk about how PROTACs relate to oncogenic disease. Many cancers are driven by proteins that go into overdrive, telling cells to divide too fast, avoid cell death, or spread. One example is BRD4, which helps turn on cancer-promoting genes in aggressive breast cancers. Traditional drugs have tried to block BRD4, but are not very effective, and cancer often finds a way around them. PROTACs change that. Instead of blocking BRD4, they destroy it completely. And lab studies, PROTACs targeting BRD4 have shrunk tumors more effectively than old inhibitors by removing the protein entirely. Another target is the androgen receptor, which fuels prostate cancer. A PROTAC called ARV-110 is in clinical trials right now for advanced cases, and it's working even in patients whose cancer no longer responds to hormone therapy. In the United States, about 90,000 men each year are diagnosed with treatment-resistant prostate cancer. These are the kinds of cases PROTACs could transform. Let's look at PROTACs in action. This Kaplan-Meier curve illustrates the radiographic progression-free survival of patients with prostate cancer treated with the PROTAC BMS 986365. The overall median rPFS of 6.3 months demonstrates the drug's ability to control disease progression. Crucially, panel B shows a clear dose-dependent effect, with the highest dose, 900 milligrams, achieving a median rPFS of 8.3 months. This robust data highlights the promising clinical efficacy of PROTACs in providing sustained disease control and underscores their potential to improve patient outcomes. Now, let's talk about PROTACs and their relation to neurodegenerative diseases like Alzheimer's, Parkinson's, and Huntington's. These diseases aren't caused by infections, they're caused by toxic proteins that build up in damaged brain cells. In Alzheimer's, the protein tau misfolds and forms tangles that disrupt neuron function. Parkinson's involves a protein called alpha synuclein. Huntington's is driven by a mutant form of the Huntington protein. Until now, most drugs could only slow these proteins down, but PROTACs can potentially remove them from the brain altogether. In mice with Alzheimer's, one PROTAC targeting tau significantly reduced brain damage and even improved memory performance. It's still early, but it shows what could be possible, finally removing the root of these diseases, not just treating the symptoms. In fact, worldwide, more than 50 million people are living with dementia-related illnesses, and that number is rising fast. Now, why do PROTACs matter for global health? Well, most advanced treatments today, like antibodies and gene therapy, are expensive, complex, and hard to deliver. But PROTACs are small molecules. That means they can be made into pills, stored at room temperature, and manufactured at low cost. This is huge for the half of the world that still doesn't have consistent access to basic healthcare. PROTACs could bring precision medicine to places where infusion centers or cold chain storage simply doesn't exist. Even in wealthier countries, long-term treatment is hard to maintain. Studies show that only 55% of cancer patients finish their full course of immunotherapy. If PROTACs can work with fewer doses, or even just one, that changes everything. They aren't just innovative, they're practical and scalable. But what does the PROTAC market say? The first graph illustrates the rapid expansion of the targeted protein degradation, or the TPD market, with PROTACs emerging as a dominant and fast-growing segment, projecting from about $0.48 billion in 2024 to around $6.94 billion by 2035. This significant growth signals immense industry confidence and investment. It reflects the pharmaceutical world's strong belief in PROTAC's transformative potential to address previously undruggable disease targets and fulfill critical unmet medical needs globally. Now, everything has their challenges and their own limitations. One big challenge is delivery, especially to the brain. Most PROTACs are large and can't easily cross the blood-brain barrier. As we know, PROTACs aren't perfect yet, and that's a big hurdle for treating Alzheimer's or Parkinson's. Another challenge is the specificity. If a PROTAC is too loose in its targeting, it might destroy proteins we actually need. That's why scientists are designing smarter versions, ones that only work in the right cells or under the right conditions. AI is helping a lot here. Machine learning tools can now predict how PROTACs will fold, bind, and behave, speeding up the development and lowering the risk. Right now, there are over 10 PROTACs in clinical trials, with many more on the way. It's still early, but the field is growing fast. Most of what we call treatment today is really damage control. Traditional drugs, like inhibitors, block proteins for a while, but the target still remains. That means more side effects, drug resistance, and relapses. PROTACs are different though. They block proteins, they eliminate them, and permanently, selectively, and repeatedly, all from a single small molecule. That makes them not only scientifically elegant, but clinically disruptive. Beyond their effectiveness, PROTACs are practical. They're orally available, chemically stable, and don't require cold chain storage, unlike expensive biologics or fragile RNA therapies. That gives them serious potential in global health, where access and infrastructure are just as important as innovation. And this isn't science fiction, it's already happening. PROTACs targeting the androgen receptor and the estrogen receptor are in clinical trials, and tau targeting molecules have shown success in preclinical Alzheimer's models. Even the biotech market sees what's coming. The targeted protein degradation space is projected to grow more than tenfold this decade, from 1.4 billion in 2021 to over 15 billion by 2030. This field is moving fast because it needs to, and it gives us the rare opportunity to go beyond treating symptoms and start rewriting the biological scripts that cause diseases in the first place. That's the future I want to be part of, and that's what makes PROTACs matter, not just as a molecule, but as a mission. Thank you.